Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is May the 12th, week 62 in the COVID-19 pandemic here in Montgomery County. And today I am joined by my colleague, Commissioner Ken Lawrence. So, number of updates this morning. First, I want to let everybody know, I'm sure you've heard, that this week the Pfizer vaccine was approved as safe and effective by the Food and Drug Administration under the emergency use authorization for administration to adolescents aged 12 to 15 years old. This is great news as we continue to work to vaccinate more members of our community. The COVID-19 vaccine is now easier than ever to access, and we encourage anyone who would like to receive the vaccine to sign up or walk up to one of our clinics. The more people who choose to get vaccinated, the safer our community will be, and the sooner we can get back to normal. The Montgomery County Office of Public Health is currently administering Pfizer vaccine for those aged 12 and older, and also the Johnson & Johnson vaccine for those aged 18 and older. As a reminder, anyone under the age of 18 coming to get their vaccine must be accompanied by a parent or guardian. To all the parents who are signing up your child to get vaccinated, please be sure that you're coming to a county-run Pfizer clinic. That is currently the only vaccine authorized for people under the age of 18. While walk-ups to our clinics are available, we strongly recommend that people make an appointment on our website to speed up the on-site check-in process. Vaccine information and registration can be accessed by visiting www.montcopa.org/COVID-19 vaccine. I again want to thank our clinic staff and volunteers for their work over the last few days to modify our operations to serve these children and their families. Our goal remains to get as many shots in arms as quickly and as efficiently as possible. Anyone who books with us will have the ability to choose their clinic location, the date and time of their appointment, and the vaccine that they receive, either J&J or Pfizer. We currently are offering evening and Saturday hours at all of our sites. I'm also happy to share that we're now expanding access to second doses of Pfizer for anyone who needs one. This includes college students who may be coming home from school before they were able to get their second dose. Our vaccine registration now has an option for people to register for their second shot only. To do this, you can visit our vaccine registration page at vaccine.montcopa.org. Select Start Registration to register for an appointment. When prompted, click Yes to indicate you have received your first dose, and it will automatically take you through the regular questions to schedule a second dose appointment. As a reminder, if you or your family member have any appointment issues or questions, you can email us at COVID-19, that's COVID-19 at montcopa.org, or you can call our hotline at 833-875-3967. Again, we strongly suggest that you register in advance if possible to ensure a more streamlined experience when you arrive at one of our vaccination sites. Now I want to share an update on our efforts to vaccinate vulnerable members of our community. This week, our Department of Public Safety's mobile integrated health team was out in Norristown and Pottstown to conduct COVID-19 vaccine outreach to people experiencing homelessness. Through their efforts, 25 people were vaccinated in one day, and these efforts continue. By engaging directly with members of our community, we are overcoming vaccine hesitancy, one personal interaction at a time. I want to thank Dr. Wang and his team at DPS for their efforts, and I would like to thank all of the partners who have helped us in this work. That includes Access Services, Your Way Home, the Learning Recovery Center, Tower Health Street Medicine Physicians, and Community Health and Dental. All of these organizations are working with Dr. Wong and are playing significant parts in the coordination and planning to vaccinate as many individuals that are experiencing homelessness as we possibly can. Our plan is to continue with regular street level outreach clinics until vaccine demand in this population is fully met. Now, let's take a look at our vaccine clinic map. We continue to maintain 7 locations across the county with daytime, evening, and weekend hours. All of these locations are updated in the vaccine registration system and on our website. To see a full list of locations, hours, and parking information, you can visit our website at www.monco.org/COVID-19 vaccine. And as a reminder, you can register online or by phone to receive the vaccine through our COVID-19 hotline. So here's that hotline number again, 833-875-3967. We also want to remind residents that no-cost transportation is available to your vaccine appointment at any location in Montgomery County. And this includes pharmacies or any other location that's offering vaccine. There are currently 3 options through Transnet, SEPTA, and GoGo Grandparent for anyone who needs a ride to their vaccine appointment. And please call any of the numbers that you see on your screen. You can also call that hotline number I gave you earlier, and they can help give you the information to get connected with these folks. We have been working with our schools to make sure that students remain safe while playing organized sports and doing other types of physical activities outdoors. The Montgomery County Office of Public Health, after a review of the current case data and the likelihood that the county will soon be below the 5% positivity level, is making a change to the county's masking policy this week. Effective Friday, May 14th, 2021, Montgomery County Office of Public Health is not requiring masking or face covering while individuals are participating in high exertion outdoor activities, such as sports or exercising. In accordance with CDC and PADOH guidelines, masking guidance remains unchanged when individuals cannot maintain sustained physical distance of at least 6 feet from persons outside of their household, when on the sidelines, when outdoors with a mixture of vaccinated and unvaccinated people, and when attending crowded outdoor activities. Indoor masking guidance remains unchanged. Just a reminder that masking provides maximal protection to the individual and those in proximity to them. Nothing about this updated guidance should be construed as prohibiting the practice of wearing a mask if that is desired by the individual. We hope this small change in policy will help our student athletes feel a bit more normal on the field as we all work to get back to normal. Similarly, the governor's office announced an interim step to increase the amount of people allowed at indoor and outdoor events. Starting Monday, May the 17th, the event gathering maximum occupancy limits will be increased to 50% for indoor events and gatherings and 75% for outdoor events. Montgomery County will comply with these new limits starting May the 17th. However, it is important to reiterate that even though some mitigation measures are being reduced, the governor and Pennsylvania Department of Health have stated that masking requirements will remain in effect until 70% of Pennsylvania's 18 years of age and older are fully vaccinated. So please get vaccinated. We are happy and believe this is a step in the right direction to lift some of these gathering guidelines. But if you want to get rid of those masks, please get vaccinated. So how are we doing as a county in reaching that goal? Well, here is our weekly update of how we are doing as a county. And just to walk you through this, on the upper left, you can see the county administered vaccinations by clinic type, our Office of Public Health community sites, our first responder clinics, our mobile clinics that I mentioned earlier. And we have now given out 93,987 first doses or single doses of J&J and 71,474 second doses. In the bottom left, you can see which types of vaccines have been administered. And then over on the right, in the upper right, you can see a percentage of how we're doing. So I'm going to start over on the far right with a percentage of individuals who live in Montgomery County that are 65 years of age and older. We are now at 97.43% of those individuals as either partially covered or fully covered. And fully covered, just as a reminder, means they've received a single dose of Johnson & Johnson or both doses of a 2-dose vaccination. In terms of individuals 16 and up, we have 32.96% partially covered, 34.77 fully covered. So in total, that is 67.73% of individuals 16 and up who live in Montgomery County, partially or fully covered. Then as a percent of our total population, that takes us to 54.87% that are partially or fully covered. So we continue to make great progress, and I just want to urge people to get vaccinated. We have plenty of vaccine. It's very easy to get an appointment or just walk into one of our vaccination sites if that's more convenient for you. As you know, we've also been carefully tracking the race and ethnicity of the vaccinated population here in Montgomery County and comparing that data with census data for the racial and ethnic composition of our community. As you can see in the lower right-hand column, we continue to make steady improvement week over week in reaching all members of our community. For example, individuals that identify as African American or Black make up 9.6% of our population and now 6.5% of the vaccinated population. This is an increase from 6.2% of the vaccinated population last week. We continue to ask people to please identify their race and ethnicity when they register for an appointment. You can see that we still have 1 in 7 people who have not identified a race and 2 in 9 who have not identified an ethnicity. And we're using this data for only one purpose, and that's to make sure that we don't leave anyone behind in our efforts to vaccinate everyone in Montgomery County who wants to be vaccinated. Now, moving on to our regular update. For the week of May 5th to May 11th, we have 495 new cases of COVID-19 reported in Montgomery County. This is a daily average of 70.7 cases and brings us to a total of 58,149. These positive cases are a result of a positive test for the virus, not from the antibody test. 9 of these were from long-term care facilities. 1 is from Norristown State Hospital. 1 is from another congregate settings, and 484 from our community. These positive individuals are from 55 municipalities, and as you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1 month old to 96 years old, and you can check our county map on our data hub for more information. It can be found at www.montcopa.org/COVID-19. Today, we have 265 females, 226 males, and 4 unknown. In terms of the variant totals, we continue to see every few days an increase in the number of people who've been identified to be carrying variants of the coronavirus. Remember, only a very small fraction of people are actually tested for the variants. So to date, since the variants started to be measured, we now have 427 total, 406 of which are that B117 variant, which is from the UK, also known as the British variant. We have 6 of the B1427, 13 of the B1429, 1 of the B1526, and 1 of the P1. I'm very sorry to confirm that 12 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,314 deaths confirmed positive from COVID-19. This week, these 12 individuals ranged in age from 34 to 93. 11 of these individuals died at a hospital and 1 at a private residence. Overall, we have lost 666 females and 648 males who ranged in age from 25 to 106. If we look at the racial breakdown, we have 2 American Indian or Alaska Native, 35 Asian, 9 Asian Indian, 6 Asian Korean, 158 African American or Black, 681 white, and 423 unknown. The situation at the Montgomery County Correctional Facility remains stable. Routine antigen testing is underway for all correctional officers, and we are in the process of vaccinating all inmates who wish to be vaccinated. Our positivity rate is moving firmly in the right direction, which is really great news. Our 14-day average positivity rate is 5.68% as of Thursday, May the 6th, compared with 6.86% as of Thursday, April the 29th. And just as a reminder, on this particular graph, the orange line, the squiggly line, are the number of people who were tested on that particular day that came back positive. And then the blue line is the running 14-day average of those individuals. I'm sorry, the orange line is the total number of PCR tests performed, and then the blue line is the 14-day running average of positivity. So you can see we are definitely heading down. And as you know, a positivity rate below 5% is considered suppression of the virus. And this graph shows the daily positivity rates for the past 28 days. And you can see that over this last few days, we are really making good progress in getting under that 5%. And if we continue at this rate by next week, we will certainly be under that 5% positivity. So really, really great news for the county. Our hospitalizations are starting to steadily decrease, which again is great news. Today, we are at 141 individuals with COVID-19 who are hospitalized in a Montgomery County hospital. This is a substantial decrease from the 202 that were hospitalized on May the 5th. Of some concern, 16% or 23 of these individuals are requiring a ventilator. This percentage is doubled from last week's 8% rate. So what we're seeing is that some of the individuals that are in the hospital remain quite ill, and hopefully they will recover. Our hospitals do remain busy, and again, just as a reminder, back in early October, on October the 1st, we only had 24 patients hospitalized with COVID-19 in a Montgomery County hospital. So hopefully we're moving in that direction, but we're not quite there yet. In terms of testing, for the 14-day period ending May the 6th, 34,231 Montgomery County residents were tested, which is a decrease of 4,236 people tested compared with the 14-day period ending April the 29th. And next, we'll show you our date tested graph. And as a reminder, the gray bars are the number of positive cases on that particular day. And then we have our red, pink, blue, and light blue, dark blue and light blue lines, which really are on top of each other at this point. But these are our 7 and 14-day averages, running averages of total cases from the community and total cases. So you can see we're in a period of very steep decline, which is fantastic news. Way down at the bottom, the orange and yellow lines are the 7-day and 14-day average from long-term care facilities. And obviously that's very much leveled out. Next, we can zoom into the last couple of months, and you can just see a little more close-up view of how we're doing more recently. And again, just a very clear trend downward. So let's just keep that going. And it is time for our monthly age cohort chart. So here we are. As a reminder, the far left column shows the age cohorts, and these are the census cohorts, followed by the percent of our population that particular age group represents. The next column, beginning with April the 1st, 2020, shows the percentage of cases within each of these age cohorts and whether they've been increasing, in which case they'll be red, or decreasing, in which case they'll be green, compared with the prior month. So you can see over time that our oldest individuals who now have high rates of vaccination continue to consistently be a smaller share of our cases, and younger people a higher share. I do want to note that we continue to see an uptick in almost all ages 44 and below. The percent of cases in these age cohorts are also overrepresented, meaning, for instance, that in the 20 to 24-year-old age group, they are 5.7% of our population, but they represent 8.73% of our cases. So again, just want to urge everyone to get vaccinated. It's easy to get vaccinated now. We have plenty of vaccine available, and just let's get this done. Let's get to our 70% so we can step away from these masks. I also want to remind people that COVID is still out there and people are still getting sick. And so if you do need to be tested or have any concerns that you might have been exposed and you haven't been vaccinated yet, please do get tested. All of our sites remain open and it's easy to get an appointment. We have plenty of testing available to you. And just check the sites and the locations and just don't hesitate to reach out and get tested. And then finally, just one announcement. Tonight is another in our series of virtual town halls about the COVID-19 vaccine. And I want to remind anyone who still has questions to register to attend. Our partners at the Montgomery County Immunization Coalition have joined forces with the Tri-County Health Council, ACLAMO, Berks County Community Foundation, the YWCA Tri-County Area, and Univision on a COVID-19 vaccine virtual town hall tonight, May the 12th at 7 p.m. During this interactive town hall, speakers will discuss COVID-19 vaccines, myths, facts, and access to the vaccine and answer all of your questions. Attendees can submit questions in advance or ask them live. This conversation will be in Spanish with English interpretation available. And you can register today at www.pottstownfoundation.org/town hall. And I do want to let parents out there who might have questions know that we are putting together a town hall to discuss vaccination in adolescents now that adolescents 12 to 15 are eligible to be vaccinated. And we'll have several very well-known and trusted pediatricians from our community participating on that town hall. So as soon as we have a date for that, we will circle back and let you know. And with that, I'm going to turn over to Commissioner Lawrence.
Thank you, Commissioner Arkush. As the commissioner mentioned, some of the mitigations are being relaxed and things are starting to open up and get back to normal. And we know that people are craving celebrations, graduations are coming, date nights, happy hours with their friends and family. So I just want to share some of the great places and events to look forward to over the next coming weeks as we approach summer and mitigation measures are relaxed. Montgomery County has more than 1,850 restaurants, breweries, wineries, and distilleries. The employee population for these places is about 22,500, or 4% of the employment in the county. So we know that this industry has been particularly hard hit during the COVID pandemic, and I'm pleased to announce that the Valley Forge Tourism and Convention Board is helping those businesses get back on track with the Crave Montco Month promotional program. Restaurants, breweries, wineries, and distilleries will get free promotion, including videos, public relations, and social media on the cravemontcomonth.com website and on the Montco Makers app through the entire month of July. They'll be able to promote special menus and drinks, free appetizers and cocktails, and other deals to entice customers. Businesses who are interested in participating in the program can go to cravemontcomonth.com to sign up. And the Valley Forge Tourism and Convention Board will also be running a similar program from September 17th through the 26th for arts and culture venues and attractions that represent $100 million in positive economic impact and thousands of jobs in our county. Also this summer, the Valley Forge Sports Event and Tourism Authority will be hosting 30+ events that will have a $20 million economic impact in the area. And some of the highlighted events are the first ever esports festival at the Greater Philadelphia Expo Center in Oaks, the USA Climbing North American Cup Series featuring top Olympic climbers in the country at Reach Climbing in Bridgeport, the Advocates Pro Golf Association Tour at Bluestone Golf Club from September 20th through the 22nd features a rising professional black golf circuit that is touring in northeastern United States for the very first time. So you can find out about all these events and more exciting things to do and vacation destinations at www.valleyforge.org. And now I want to give a final report on the Montco Strong 2021 Pennsylvania Hospitality Industry Recovery Program. Since the COVID-19 pandemic began, the county has helped to award over $35 million in grant relief funds to small businesses and nonprofits across several industries. And that includes the recent awards for the Montco Strong 2021 Pennsylvania Hospitality Industry Recovery Program, which is wrapping up this week. On Thursday, the Redevelopment Authority will vote to approve the final round of 113 grants for a total of 357 awards. Of the over $9 million allocated for this program, $9,290,000 went towards the awards and $121,000 covered the cost of administration of the program. And here's a demographic breakdown of the awardees, of the 357 awardees. 50 municipalities are represented. 32% of the applications are from a self-identified minority-owned business. 34% of the applications are from a self-identified woman-owned business. And 4% of the applications are from a self-identified veteran-owned business. The list of awardees will be posted next Tuesday at www.montcopa.org/commerce. And we would like to thank the Board of the Redevelopment Authority for their partnership in this program, and the Montgomery County Commerce Department for all the hard work they did in promoting this program and analyzing the grant applications. And that concludes my report, Commissioner Arkush.
Right. Thank you, Commissioner Lawrence. It's so great to hear about these upcoming events that we'll actually be able to go to in person. So pretty exciting. All right. With that, we are both happy to take questions.
Our first reporter will be Jim Melward from KYW.
Going back to the easing of the mask restriction, what does this mean, or what do you expect this to mean? I guess, does this mean that schools can immediately? It's still up to the school or the athletic organization, correct? I mean, kids just can't run out there without masks if the organization still requires it. Is that kind of where this goes?
That's correct. So this new guidance will go into place on Friday, and schools or any sports league, any organization always has the option to implement their own health and safety plan. And it can be more strict than what the county or PADOH is recommending. So it will be up to the schools or the sports league, for instance. But if individuals do not want to wear masks, in that, if it's okay with the organization, then they would not have to.
And I don't know if this is the proper venue for a primary related question, but Commissioner Lawrence, just wondering if you have any numbers on mail-in requests and any update on what you've gotten back, what you expect, those kind of things.
So I think we had about 75,000 ballots that have been mailed out. I did not get the final numbers yet. I can get that for you. And we have about 50% of those back so far. And
just a quick follow-up on that. Do you have any kind of guess when you might have results or following Election Day?
I don't want to guess. I think we will move through it fairly rapidly. Of course, we're going to have much fewer ballots to count than we did for the general election. And I know Voter Services has been working very hard to maximize the use of the equipment that we have. So I think we will be done, fairly quickly on election day or shortly thereafter.
Great. Thanks.
Next, we'll go to Krista Shoemaker from the Intelligencer.
Good afternoon. Just one quick question. What kind of demand are you seeing for vaccinations for 12 to 15-year-olds? Any idea of how many people have made appointments or if anybody showed up in that age group yet to any of your clinics?
The demand has been pretty strong so far. Yesterday, we had 300 appointments for individuals that were between 12 and 15. And I don't have the final numbers yet, but they also saw a number of people walk up, just, came in kind of spur of the moment. So I don't know what today's numbers are, but yesterday was pretty robust. And by the way, to put that into some context, we did get information from the census that Montgomery County has 48,534 12 to 15-year-olds, at least whenever that last count was done. I think that might be from 2019. So it just gives you a sense of how big that population is, about 48,500.
Thank you very much.
Our next reporter will be Kenny Cooper from WHYY.
No questions.
Okay, we'll move on to Carl Hessler from the Pottstown Mercury.
Afternoon, commissioners. Question on the vaccines for everyone over 12. Are you in touch with the various superintendents of the school districts, and are there any plans to actually hold vaccination clinics at any of the schools, perhaps in gymnasiums or anything like that? And what has been the response of the superintendents that you've talked to so far?
Well, we continue to meet weekly with all of the public school superintendents, and we meet about every 2 weeks with representatives from private schools. And they were all enthusiastic and very hopeful that they would be able to, or that their students that were between age 12 and 15 would be able to start to be vaccinated this week. And we are still in discussions about holding clinics at various schools. So that remains to be sorted out. But, right now we've got 3 different malls that families can take their kids to: King of Prussia, Montgomery Mall, and right next to the Willow Grove Mall, as well as several other locations. So in the meantime, I don't know if we will end up doing school-based clinics or not, but in the meantime, it's very easy to get your adolescent vaccinated.
Okay, and on the mobile vaccine unit, you spoke about the homeless population. Can you give me that number again? Your voice kind of faded out or something on the computer when how many people were vaccinated during that effort?
So far, they've vaccinated in that first day of real intense outreach, 25 individuals who are experiencing homelessness.
Okay. And one final question, where are you standing with the vaccinating the homebound individuals with the mobile unit?
So that is making good progress as well. As of yesterday, I believe we had worked through the entire list of people that had registered with us. Some of those individuals had already been vaccinated, so the whole list wasn't needed at that point. And I believe they have vaccinated with Johnson & Johnson for the most part, unless the individual wanted something different, just about everybody on our list. So we're making really good progress. If people still need our homebound and still need to be vaccinated, they can absolutely still call our hotline and register for that. And we should be able to accommodate that request pretty quickly.
Okay, thank you. That's all the questions I had for today. Thanks.
Yep.
Our next reporter will be Tony Wood from the Philadelphia Inquirer. Tony, looks like you're still muted right now if you're trying to speak. Okay, for now, we'll move along and see if Tony can get his technical issues resolved. We'll go to Maria Marabito from the Delaware Valley Journal.
Hello.
Just one quick question about mask mandates. The CDC hasn't updated the mask mandates related to outdoor summer camps yet. With Monco's upcoming change with masking when exercising outdoors, will this affect the summer camps in Monco?
Well, for right now, the Office of Public Health has simply stated that if you're doing strenuous physical exertion or exercising, that mask wearing is no longer required. So that would apply to summer camps. Anything beyond that will just have to remain to be seen in terms of what the Office of Public Health wants to do.
Okay, thank you. That was all I had.
Looks like he's unmuted, so we'll go back to Tony Wood from the Philadelphia Inquirer.
Yes, sorry about that. I accidentally muted myself. Just two quick things. First, when do you project reaching the 70% threshold in the county?
Oh boy, Tony, I don't know. I hope. I mean, and remember, the governor's guideline here is 70% fully vaccinated, which means 2 weeks have to go by from that injection. So
Right.
it's a while yet. I mean, I don't think it will be before July, and hopefully by July, but I don't know. We are going to need people to really decide to get vaccinated if we're going to get there by then.
And it seems as though the reports of the adverse reactions, but have you had any reports of adverse reactions to vaccine in the county?
We've had some mild reactions. We've had a few people feel a little faint, a little lightheaded, that sort of thing. But I'm not aware that we've had any serious adverse reaction at any of our vaccination locations.
Well, that's it from me.
Thank you.
This concludes our questions for today.
Thank you, everybody. Take care.